Over the last several weeks, all of us at mHealth Fairview have learned an evolving vocabulary. We've received daily information about PPE availability and the ways which we must adapt to care for patients safely. While we continue to secure more PPE to handle a potential pandemic surge, we have been taking guidance from the CDC and the Minnesota Department of Health for how to provide the best patient care while keeping ourselves safe during a period of limited resources. In this brief video, we aim to untangle some of the complexities surrounding the evolving PPE policy for mHealth Fairview during the COVID era. By using real footage filmed at the University of Minnesota, we'll aim to clarify some common questions surrounding PPE during this unique period. Let's start with our first definition, universal masking. This policy is aimed at keeping all workers in the clinical setting safe by providing them one mask per day that's worn for the entirety of that working shift. The type of mask, N95 or surgical mask, depends on the type of clinical encounters. Another definition to visit is careful reuse. This is the targeted reuse of certain PPE that can be worn between patients or on more than one day after undergoing decontamination. In addition to seeing what some of these mask policies look like in the real-world setting, we'll also take the time to review some of the nuances of hand hygiene and donning and doffing procedures during the COVID pandemic. So with that, let's get started with some real-world examples. Let's first take a look at the changes in donning and doffing procedures in the context of universal masking, or not taking our mask off for the duration of our shift, and careful reuse of our face shields. As a reminder, donning and doffing is just a medical way of saying putting our PPE on or taking it off. The only way for universal masking to be safe is if we wear a face shield when seeing patients on droplet or airborne precautions to protect the outside of the face mask from droplets. The type of mask you'll be wearing will depend on the clinical situation you're working in. Let's start by reviewing some of the nuances surrounding a surgical face mask. Here, our provider is on a non-COVID unit and is wearing a surgical face mask for the day. She's about to see a patient that is on droplet contact precautions, but is a non-COVID patient. Remember, if this patient had COVID or was being evaluated for it, the provider would require an N95 mask. We'll discuss that later. Before she dons her gown, she performs hand hygiene, following the steps pictured and taking at least 20 seconds. She'll now put on her disposable paper gown and tie it in the back. In order to keep the outside of her mask clean for the rest of the day, because this patient is on droplet precautions, she will place a plastic face shield over the entirety of the mask. After doing so, she'll take another 20 seconds to perform complete hand hygiene, and then she'll put on the appropriate sized rubber gloves. After entering the room, performing rounds, and examining the patient, it's time to doff. This procedure is slightly different when using universal masking. It should occur in the anteroom if one is available, or in the patient's room greater than 6 feet away from the patient. Before removing any of her PPE, she'll perform hand hygiene over her gloves. She'll then grab the front of her gown, pulling it forward and away, and then folding it into a ball outward, removing the gloves with the gown. Once again, it's time for hand hygiene. Believe it or not, once exiting the room, one more round of hand hygiene. If she's using the trick of singing 2 happy birthdays per episode, she's now at least 8 years older than when she started. In order to clean the face shield, she now must put on a new pair of gloves. She can then grab an appropriate disinfectant wipe, remove her face shield, and then clean both the face shield and the storage area. Noting that different units may have different policies about storing a face shield versus taking it with you from room to room. Now she gets to remove her gloves and sing happy birthday to herself 2 more times. Note this entire time, She's never touched her face mask, and it's safe to be worn for the remainder of the day at work. Note, the only differences when wearing a reusable gown occur in the doffing procedure. Rather than peeling the gown off over the gloves, first the provider performs hand hygiene on the gloves, removes the gloves, performs hand hygiene again, and then carefully removes the gown, folding it away from the body and placing it into the appropriate receptacle. The remainder of the procedure is the same. While with universal masking, the mask is meant to be worn throughout the workday, there are times it will need to be removed, such as for eating or drinking. Let's review how to do that safely and carefully store the mask for reuse. Like you've probably guessed, the first step is to perform hand hygiene. Then, you'll remove the mask, folding inward to avoid touching the exterior of the mask. This surgical mask can then be stored in the designated bag or storage area being used on the unit you're working in. Then, once again, perform hand hygiene. Let's go over some key points of uninterrupted mask use. First, we should all make every effort to not touch our face or masks while we're wearing them. If we must touch our face, we should perform hand hygiene immediately. Additionally, if our mask should become visibly soiled, damp, or damaged during the day, or if an appropriate fit is not maintained, it should be thrown away. Now let's look at some of the nuances of universal masking, donning, and doffing when using an N95 face mask. Some units will be using an N95 face mask for the entirety of their universal masking day. Others will be using it only for certain patients or procedures. Regardless, many of the principles of universal uninterrupted masking are the same, including the fact that for the exterior of the mask to be protected, a face shield must be worn in patients that are on droplet or airborne isolation precautions. In this example, the provider is changing from a universal surgical mask to an N95 to see a patient requiring this for a procedure. Keep in mind, however, some units will be wearing an N95 mask for the entirety of their universal masking day, and therefore these switches may not be necessary. Note how she performs hand hygiene before and after the mask switch. Now that the N95 mask is on securely, the donning and doffing procedures for entering the room of a patient on droplet or airborne precautions remain the same as they did with a surgical mask. If not on a unit already using N95s as their universal masks, if you needed to place one on to see a patient requiring one, it can remain your universal mask for the remainder of the workday. One thing worth noting is some face shields have a built-in paper mask at the bottom of the face shield. These can be used over an N95 mask, but are considered single-use and should not be sanitized, but instead discarded after use. The N95 can remain, however, as your universal mask moving forward. As we are learning more information daily about the ability to sterilize masks at the end of a workday, it is best to check with your unit leadership at the end of your shift to find out the current practice for what to do with your face mask from that day. We hope this video provides some clarity about the evolving approaches of keeping each other and our patients safe during this unique period of PPE shortages. We will continue to take our guidance from the CDC and the Minnesota Department of Health and keep you informed along the way. We are grateful for the tireless work being done, caring for patients and about each other during this difficult time. Thank you.